I'm Dr. Christopher Bunick, Associate Professor of Dermatology at the Yale School of Medicine. I had a number of posters here at the American Academy of Dermatology in 2026, and I want to highlight one on JAK inhibitor safety, the long-term or 6-year safety data for upadacitinib. Because I think that as JAK inhibitors proliferate throughout dermatology, we need to understand more and more their long-term safety. And it turns out that actually upadacitinib, with its 6-year continuous safety data, is the longest safety data that's published in the atopic dermatitis space. So it's very informative and helpful for us. It's also important to understand that this data comes from Measure Up 1 and 2 trials. In fact, the patients weren't cherry-picked. A lot of them had cardiovascular risk factors. In fact, over half of them had some level of cardiovascular risk factor. This is important because what we see in this data is we see very, very low rates of any type of adverse of special interest, whether it's MACE, VTE, or malignancy. This is really reassuring that we're seeing no increased signals over time, out to 6 years, and over 9,000 patient years of treatment. We're not seeing increasing signals for any of the things that we might have been concerned about several years ago. In addition to that, what we are seeing is that the highest rates continue to be around 3 to 5 events per 100 patient years of herpes zoster. And in this particular trial, the reason we see that is because less than 5% of the patients had shingles vaccine. So one of the things that we can continue to do as a dermatology community is to, in the appropriate patients, think about shingles vaccine to at least reduce that particular adverse event. But most reassuring is also when you look at the women that were in these trials, those that were on OCPs, there was no increased risk of MACE or VTE for the women that were on OCPs. This is also really encouraging to the safety of JAK inhibitors.